Hi guys, me again. I am 4 weeks and 2 days post-op. I've had my follow-up appointment. I had that earlier this week. He said all is good. I had my first post-op x-rays. I will put them on this video. I ended up with only 4 screws. I thought I was going to have more, but there's only 4. They look a little bended too, which I don't, he didn't seem concerned, so, and I guess he saw it. And then I'll just tell you a little bit about how this past month has gone. And I apologize that it's taken me so long to make another video. But let me show you the pictures of the x-rays. Before I get too far in the video, I wanted to backtrack a little bit. I did find some video when I was in the hospital that I didn't realize Mom had taken. And I did want to go ahead and put them in there. The audio is not good. You can't hear anything in them. It's just me walking down the hallway and getting situated in a chair. And you can just kind of see uh, how I was doing at the hospital, how slow I had to take it. And I wish I had them in the other video, but better late than never, I guess. I'm going to go ahead and get it over with and show you pictures of the incisions. These are not current. This is more probably about 2 weeks post-op, I'd say. Um, you'll see my fat roll, so just get over it. And you can kind of see it. The front one is 9 inches long. The back one's about 8 inches long. My only therapy that my surgeon said to do was walk. So I have some pictures of me walking. He wants me to walk a mile a day, which I didn't do a mile a day before surgery. So I lack motivation, and it's really hard for me to get out there and walk a mile a day or walk at all, really. He said walking is what's going to help stimulate the bone growth, so I need to do it. It's hard because my street, there's only a certain part this way that's flat and a certain part that way that's flat, so I don't really have a good spot. But okay, enough with the excuses. I need to walk more. Yeah. When I came home from the hospital for 1 week, my mom had to give me an injection in my stomach for blood clots. It was a blood thinner, and I videoed her doing it. And that way, if anyone's nervous about it, I mean, this is not an instructional video. This is not telling you how to do it. This is just showing you how mom did it to me. And at the hospital, it didn't hurt, really. I didn't really notice it. Well, I was on more pain medicines too, so. But I never really noticed it hurting at the hospital when the nurses did it. When mom did it, it would kind of sting a little. I'm like, oh, don't do that. And when she's injecting the stuff, you could almost, I mean, you can feel it, just soaking in. Um, the very last one that she did, darned if that didn't hurt the worst. I mean, I screamed like, ah, and it left a big old bruise. I don't know what she did different, but yeah, for a whole week we had to do this. One time, two of my cousins' children came over, ages 4 and 5, and they wanted to see my stomach and my back and everything. The audio again is horrible on these other little videos, so I'll just kind of tell you what he says, so you know what's going on when you see these videos. My mom is undoing the straps for my brace, and she takes the top part off, and Gabby puts her hand on my belly, and she goes, "It's wet," because it's hot, it sweats. And then Charlie rubs his hand on it, and he goes, "And hot." It's just really cute. I love them kids. And then it's really cute, and mom was gonna do the injection for the blood thinner, and they wanted to help, so they each got a little alcohol swab to clean off a little area, for mom. Well, they're doing like all over my belly. He wants to do it over here, she wants to do it over there. So they finally get it down, and it's so cute. If you look, Charlie takes his little alcohol swab and unfolds it and lays it down real nice and neat to wipe. It's so cute. Um, and then one thing I didn't get on tape, and I was so sad, when mom's getting ready to do the incision, when mom's getting ready to do the injection, she takes the cap off the needle, and Charlie sees the needle, and he was like, he's pulls away like, you can see that part in the video, but nothing else. And he goes, "Don't shoot my Fluffy because I love her 10-1." And that is so cute because they call me Fluffy because they couldn't say Stephanie when Gabby was little. She couldn't say Stephanie or Steffi, so it came out Fluffy. So now I'm Fluffy. And when people say, I love you too, Charlie's adapted a new way to say it, and he'll make up numbers. He'll just say, "I love you 791," and it's cute. So he loves me 10-1, and it is just his expression during the injection is just precious. And Gabby during the injection, like, she'll look down and she'll keep looking up at me, just making sure I'm still alive. It's really cute. Well, I'll go ahead and shut this video down. Couple of last things, some things that had happened during this past month, earlier, and I had to call the doctor about, is when I would take a deep breath, I would feel like a little snap or pop in my lower back, right where the surgery site was. That was concerning, but they said, it's okay, that can be normal, and to just keep walking and resting. So that was interesting. Another thing that's happening is certain ways that I move. I have this pain, and it feels like it's a pressure. Like when you're at the dentist and they're pulling your tooth and they clamp onto it and they're pulling with all their might. And it feels like every single blood cell is going to that area. That's what it feels like. There's no warning. It's not, it's not like, oh, starting to feel bad. Oh, it's hurting more. No, it's just, I'm fine, I'm fine. Boom, and it hits you. And it's mostly when I'm laying down and I'm trying to roll over. Doctor confirmed that that is actually the pieces in there and the bone like pulling against each other. So that's not good. He told me, when I feel that, stop what I'm doing immediately and don't ever do it again. So that narrows it down. Um, but I don't know really what triggers it. It's just, and I go slow. It's not that I'm trying to roll over fast. I don't know. So be careful if you're trying to roll over. I'm trying to think. I don't think that there's much else that has gone on this past month. I don't use my walker very much. I only use it if I leave the house for a walk or if I go in a car. I've only been in a car twice since surgery. And around the house, I don't use my walker at all. My incisions are both front and back, pretty much healed. I mean, well, they are healed. They're closed. They're healing. They look really good. Um, I think we're definitely stepping in the right direction. And if you've had this surgery and you're going to have this surgery, I wish you the best of luck. I will keep posting on here updates on how things are going and doing, and just good luck. And I hope that my videos have helped somebody out there. So thank you very much. And that is the end of 4 weeks and 2 days post-op.